Many breast surgeons in this country have made the observation that even though we're picking up cancers at an increasingly earlier stage where they could be easily treated with a lumpectomy, these are the same women who are making the decision to not only have one breast removed, but both breasts removed. And studies have shown that there's probably very little survival advantage in doing that. Women don't live any longer by removing a healthy breast. But that doesn't negate the fact that more and more women are making the decision to do that. So we were interested to know, if we're not prolonging life by removing the other breast, are we at least improving the quality of life in women who choose to make this decision? So that was the underpinning of why we undertook this study. So first off, the reason that we were able to do this study and in such a short period of time is there's a group of women who are known as the Susan Love's Army of Women. And if you look online, you can find this group. And it's about 200,000 women in the United States who've been affected by breast cancer in some way. So a good number of these women have had breast cancer themselves. Others have had friends or family members affected by breast cancer, and they've all come forth as being interested in participating in clinical trials and expanding research around breast cancer. So we contacted this organization and let them know that we were very interested in looking at quality of life after breast cancer surgery. And we sent out this web blast to the group, and within 48 hours we got about 7,000 responses back from women who were interested in filling out this survey and sharing with us their experiences of what had happened after they had breast surgery. We, in this recent study, looked at a subgroup of those patients. So we looked at the 4,000 women who responded to the survey and had undergone mastectomy. And of those, about a third had chosen to have the other breast removed as well. So we found a couple of things. I mean, first of all, the data that we had supported the evidence that's increasingly shown, which is that women who are choosing to have the healthy breast removed are by and large younger women. They're women who are well insured. For the most part, they're women who actually have the choice of either to do a lumpectomy or a mastectomy. And instead of choosing to do the smaller procedure, a good proportion of these women were actually choosing to have the healthy breast removed in addition to the breast that has cancer. So that is consistent with a lot of the other studies that have been previously reported. What makes ours a little bit different is that we were then able to survey these women about how they felt about their choice, how this choice impacted their quality of life, and whether it made them feel any differently about themselves. So the survey was based on about 100 questions that asked about various different aspects of patient-reported outcomes. And there were 4 main different types of questions that we asked. One type of question had to do with just general psychosocial well-being. Were they happy? Were they confident? Did they have good self-esteem? How was their general psychosocial health? Another group of questions had to do with how happy they were with their overall appearance of the breasts, if they were comfortable in their clothing, whether they felt self-conscious about themselves. Another bunch of questions had to do with how comfortable they were physically. Were they able to do everything they wanted to do? Did they have any pain, tightness? Were there physical aspects of the kind of procedure that they had? And the last group of questions had to do with how comfortable they felt with their sexual functioning and whether the surgery they had impacted that in any way. Most of these questions were then transferred into a number from 0 to 100 that indicated how happy they were, how high their level of satisfaction was. And on this 100-point scale, we actually found a difference of about 1 point among women who had the healthy breast removed versus those who chose only to have one breast removed. So hardly any difference at all between the women who had had a prophylactic mastectomy versus women who only had mastectomy on one side. And then we looked to see if there were other factors that differentiated people who had a higher score versus a lower score in terms of their satisfaction. And what we found, and this corroborates other studies, is that the choice of whether to do reconstruction or not impacted patient-reported outcomes much greater than a decision to remove the healthy breast. So I think if the decision point is, should I just remove one breast and have reconstruction, or should I remove both breasts? As long as you have reconstruction, I think both groups of patients are equally happy. But for women who are choosing to undergo mastectomy and reconstruction, removing the other breast doesn't necessarily increase their satisfaction with the long-term outcome. It doesn't improve their physical well-being. It doesn't appear to substantially increase their psychosocial function. And it didn't appear to have any impact on how happy or satisfied they were sexually. So I think there are a few reasons underlying the decision of whether to undergo a unilateral or a bilateral mastectomy. And I just want to be clear, this is a decision to remove a part of the body that's perfectly healthy. And surgeons at all of our national meetings are concerned about this trend because as surgeons, we like to confine our interventions to things that we think will help cure cancer. And clearly, removing a healthy breast is not making much impact in curing cancer or improving outcomes from cancer. So we have lots of discussions about whether we should try to talk women out of doing that kind of procedure. But the reason women continue to want this, and probably they're choosing this decision more often than they ever did, is they like to have some sense of control over what is going to be happening to them in the future. And I think many women see removing the breast as a certainty that they will never get cancer in the other breast, and it's hard to argue with that. But I think that decision is really driven by a mistaken notion of how high their risk of cancer might be to the other side. If you survey women in general, about a third of women feel like they're probably going to end up getting cancer in the other breast, but the reality is that that number is probably less than 5%, and in some groups of patients it can be even as low as 1%. So I think that decision is often made from a place where they don't really have accurate information about their risk of a new cancer in the opposite breast. And I think women just feel that having the other breast removed will just alleviate all anxiety about cancer. And I think what our study shows is that you can remove the breast, but anxiety about cancer is not something that's easily treated surgically. So if that's the only reason that women are considering having this procedure, they need to weigh their motivations for having additional surgery on a healthy breast with the downside of potentially more infectious complications, having more surgeries to try to revise their reconstruction, and all the other side effects that can come with more surgery, including pain, numbness, and repeated side effects or complications from the interventions that are required to take care of these complications. Yes, I think it's really important to be clear that this study was really aimed to look at a group of women who had an average risk of breast cancer in the opposite breast. So as I was saying before, their 10-year risk of having a new cancer in the other side is probably somewhere between 2 and 5%, very low risk. There are a group of women who are at exceedingly high risk for developing a secondary breast cancer. So those are women with genetic mutations like a BRCA mutation and some other genes that we're finding really increase a woman's risk of developing a second breast cancer. For those women, I think it's much more important to consider having the other breast removed because those women can have up to a 50% lifetime risk of having a new cancer. So obviously those are the women who could potentially benefit from having even a healthy breast removed preventively. So the take-home message I feel from this study is that it's really important to see what the impact is of the decisions that we make. I think at the time when a woman's making a decision to either undergo a lumpectomy or mastectomy or even a double mastectomy is a particularly vulnerable time. But I think it's really incumbent on the medical community that when women are trying to make that decision about what to do, that we discuss with them all the potential benefits, but also the downsides of what could happen long term in terms of physical side effects resulting from reconstruction. And this is all in an effort to try to help make patients the best decisions possible from a place of knowledge rather than just fear of the unknown.